Welcome to the National Rural Health Executive Webinar Series. My name is Colleen Bay with NRHA Services Corps. Just a couple of housekeeping notes to review before we start. Everyone will be muted. We like to get through our webinar in about 40 minutes to save some time at the very end for questions. If you have a question for any of the presenters at any time, don't hesitate to go ahead and punch it into your GoToWebinar control panel, and we'll make sure that it gets covered. And as a reminder, this event today is being recorded, and you'll get an email with a link before the end of the day. Today, we have two presenters, Mike Milligan, President of Legato Healthcare Marketing, and Ralph Llewellyn, Partner in charge of Critical Access Hospitals with Eide. As President and owner of Legato Healthcare Marketing, Mike Milligan is actively engaged in identifying solutions to build the brands and volumes for rural hospitals, specialty clinics, and medical products, trade associations, and solution providers for the healthcare industry throughout the U.S. Legato is the exclusive marketing partner of the National Rural Health Association. Before starting Legato, Mike served as Vice President of Communications for Privia Health and Director of Public Relations and Strategic Communications with Aurora Healthcare, both in Wisconsin. As a healthcare marketing expert, educator, and media trainer, Mike has led roundtable discussions on healthcare marketing at national conferences and has directed strategic planning efforts for a variety of organizations, serving as counsel for CEOs and other executive team members. Mike is also the contributing author for leading healthcare marketing publications and shares his insights weekly through the nationally recognized Legato Healthcare blog at www.legatohealthcaremarketing.com. Ralph Llewellyn started his healthcare career as a rural hospital CFO. For the past 23 years, he has been with Eide, where he conducts operational assessments and assists providers in enhancing financial and operational performance. He provides chargemaster, cost report audits, and redesign products, conducts reimbursement enhancement studies, and assists in development of physician compensation strategies. Ralph is a frequent speaker at state, regional, and national healthcare conferences. We would also like to say thank you to our partners, Legato and Eide. Legato has been a dedicated NRHA partner since 2013 and Eide since 2010. We appreciate their support and the industry expertise they bring to our rural hospitals and clinics. NRHA partners play a significant role in supporting NRHA's advocacy efforts and make it possible for us to put on educational conferences dedicated to rural healthcare issues and topics. With that, I'm now going to turn it over to Mike for our feature presentation, Aligning Your Marketing Plan with Your Strategic Plan.
Excellent. Thank you, Colleen, and thank you everyone for joining today. I know we had a pretty good registration number, so it means this is an important topic for people, and certainly as we're looking at the end of the calendar year and we're doing planning for next year, we're probably all thinking about that. And it's my pleasure and privilege to be co-presenting with Ralph. Ralph is just one of those icons of the rural healthcare industry, and have worked with him for a number of years, and our companies have worked together for a number of years in terms of helping, really working together on behalf of clients in terms of their strategic planning or their marketing planning overall. And we'll talk more about that in a bit in terms of the data gathering. So I'm just going to go through the agenda here first, just kind of what we plan to cover, and then I'll turn it to Ralph, who will first go into some detail regarding the strategic planning, and we'll transition from there of how marketing planning is an important aspect of that. So as we look overall at your strategic planning, we're looking at, okay, overall, how do you really develop your scope? What are we trying to accomplish? More broadly speaking, not only what is your strategy, but what are your strategies? Things that we often face in our organizations, which is we can do the right things and do the right things on paper, but this is a people business. We got to bring people on board, whether or not those people are providers or the admin team or what have you. Who leads that process? Is it someone externally? Is it someone internally? What information are you using in terms of, for sure, the basis of your community health needs assessment, which I think is one of the more underused tools that we don't really rely on as much. And of course, how does the information that you're working on align with your mission, vision, and values? And we'll talk, of course, about various data to drive the decisions, to then form a strategic plan, and then as part of that, a data-driven marketing plan. So, Mr. Llewellyn, I will turn it over to you.
All right, thank you.
You're welcome.
Thank you for the opportunity to get to visit with you guys today. Definitely want to get some good conversation going here on an area and a topic that I really feel is such a huge, important issue that's also a big challenge for organizations. So let's just jump into some of the meat here. As we look at, the first conversation, when you look at the strategic plan, it's really trying to figure out what's that scope. And, we see a variety of different ways that this is done. And I don't want people to think that one is right and the other one's wrong. It's more about what fits for you and makes sense at the time. So a lot of times we see facilities looking at more of a one-page bullet list, kind of a strategic priorities. That's more planning probably than it is actually the plan. Others get into very robust documents, and we talk here about a full 60-page strategic plan. 60 pages is just an example. It might be more, it might be less, but it's really digging down into the more of the meat. And so when you look at the starting process of this whole scope, it's really, what do you need and what do you want out of a strategic plan? Because the more comprehensive, I think at times one can argue the better, but something is better than nothing. And obviously with all the things that have been going on in this COVID world, sometimes you might just find that getting something is going to be better than nothing because of all of the other competing interests that are going on within your organization. So, do you have a mission, vision, and values? If you don't, you're probably going to have to go deeper the first time. Do you have a recent strategic plan? The more recent, maybe you don't have to go as deep. You got to just, brush it off a little bit. There's been huge organizational changes. If you have lots of organizational change, maybe it's time to step back a little bit more. And I think the most important piece is really think about everything that's changed with COVID. Technology, patient preferences, all of those things. So even if you did this, let's say in March of 2020, is it even still valid? Do you need to step back and at least do that one page, relook at that strategic priorities to see, does it make sense with what our organization is today? So we'll move on now to kind of what is strategy. So that's the next slide. And really what we're looking for here is, what is strategy? It's a plan, action, or policy decided, to accomplish a goal. Really at the end of the day, it's, how do we get to our desired mission or our desired destination? That's the strategy. What's our roadmap? And, if you don't have this, if you don't have the strategic plan, the thing I always ask people is, how do you know you're going in the right direction? Without a plan, how do you know you're going in the right direction? Your organization may be moving very quickly. You may be getting a lot of things done as you move to the east, but if you do a strategic plan, maybe you find out that you should have been moving to the west. And so it really comes down to, not just what are you doing, but is it putting you in the right direction? And some of that will get into a little bit further conversation later when we talk about how the marketing plan then ties into the strategy. Because there again, at the end of the day, we want to make sure we're all moving in the same or the right direction. As we work in the process of strategy, we get into that whole component then in the discussion about, the people. And so, who do you have involved? And again, this is another one that I've seen done both ways. And so the two ways I'm going to talk to you about it, I can tell you I've seen facilities fail doing it each way. I've seen people be extremely successful each way. And it really comes down to more of the organization and who the individuals are that are parties to it. That probably makes the big decisioning factor about does it work or not for the organization. So sometimes we see small groups, and it's probably more often that it's small groups. And it's the executive team and the trustees or the board that are getting together and doing the strategic plan. Oftentimes as part of a retreat. Other times we'll see it where it's a bigger effort. You've got your community survey, maybe it's focus group, maybe it's your community health needs assessment. Providers, department managers, on top of that small group that you already started with. And even within that, we see it work differently within some organizations. Sometimes it's just getting a lot of input from the bigger group, yet it's the smaller group or maybe a mix of a smaller and a bigger group that actually put together the plan and spend the larger portions of time together. Because sometimes you may be able to get too many people in a planning process and it kind of bogs it down a little bit. But really, you got to step back and figure out, who's going to build this and how are you going to get buy-in? And one thing I'll say about buy-in is what I find is that the people that get that little bigger group, or they at least question and get the input from them, it's easier to get the buy-in. Because at the end of the day, whatever comes out, it's going to be a larger group that has to implement this. It's a larger group that has to be, making the movement. And sometimes we'll find that the larger the group is, at least for the input side, the easier it is to get the buy-in. It's easier to get people engaged when you start getting into the next steps of how do you implement this? How do you get people excited about it? Because they were part of the conversations, they felt heard, they had input, and you really can do things, in a much more effective way. And again, either way can work. It really comes down to the individuals a lot. I tend personally to like to get a little bit more of that bigger group involved, at least in the beginning, maybe even sometimes all the way through, depending on the individual organization.
Would you say though, Ralph, that don't necessarily expect consensus? I mean, from, I mean, you want that. I mean, but you want consensus, but you don't necessarily expect that everyone is going to agree with everything. They're part of the process, and everybody has input. But it takes some negotiation as well.
Right. There's still negotiation. There's still management. There's still leadership that goes on.
Right.
But the fact that people get heard, if there
Right.
was at least conversation about what they put in, it may go in a different direction. But people, the hard part about implementing a plan where no one had involvement is the item that they had as an idea,
right,
which may be easily, quickly debunked in a conversation, never got heard. And the fact it never got heard, you can never resolve it. You can never get them past that, well, we should have done this. Whereas if you have a group conversation, you can at least get a decision of as a leadership and hopefully as a group of consensus. But at some point in time, somebody just has to make a decision.
Correct.
So perfect piece there. So who leads this? Again, this varies, and again, it can work both ways. Internally, I've seen CEOs, board chairs, maybe a local motivated person who's really enthusiastic and is a good leader in the community. It could even be a department head if you've got the right person. It really comes down to a lot of personality. And so I, the comment here about it being a motivated, enthusiastic individual. Let's face it, strategic planning is not a whole lot of excitement and really, wow type of thing. It's a lot of work, and you need to get somebody who can incite some energy and some energy around all of this. Sometimes it's an external consultant. I think that the important part is whoever it is, on top of that motivated and enthusiastic individual, you want it to be somebody who really understands the industry. So if you don't have that expertise internally, that's where sometimes that consultant can come in. The consultant may not even be the leader, but they might be able to throw in things they're seeing in the industry, trends, new rules, new regulations, new technologies, new things to be thinking about. But at the end of the day, whoever is going to lead and be involved, you need to have somebody who's got that motivation, that drive, that energy to keep the process moving, keep people excited about what they're doing. And someone in there has to have industry knowledge. It does not have to be the same person. The two are going to have to work well together because one can't totally control it over the other, but it really does work well there. So let's start talking then about, what should be included in a strategic plan. And Mike, I really like what you said at the very beginning here about the community health needs assessment and it not being, used to its fullest. We've put in here kind of what it is as a requirement. So if you are subject to 501 R3, you're a nonprofit hospital, you are going to have to do a community health needs assessment. It's that mandate or that requirement that you have to do it that sometimes I think turns people off. It's got to be done every 3 years. And so we see such a huge variation as to what people are doing in this arena. I have some facilities that do they basically check the box. They do everything to the very bare minimum and it looks like it. They don't get a whole lot of data in it. I have others that look at this as, yes, it's a necessary evil that I got to go through, but while I go through the process and go through the pain and the challenge, I want to find out everything that I need to know about the community. So when I'm looking at this here, it's asking the tough questions. It's really digging into, when people aren't using me, where are they going? Mike and I can't always get you that kind of data. I mean, we'd love to say there's perfect marketing data out there, but if people will tell you where they're going, that's perfect. If they can tell you why they're not coming to you, that's even better yet. Because now you can start figuring out, are there things we need to do in marketing because they don't know about us? Or are there things we need to do operationally because there's perceptions or whatever it is? But this piece really drives then into that strategic plan. So at the end of the day, the focus of the strategic plan has to be on the health of the organization, and the organization has to also be focusing on the health of the community. And it all ties together. So a good strategic plan is going to spend a lot of time really looking hard at the community health needs assessment. I can tell you at times I'll look at a finished strategic plan and I'll look at a community health needs assessment and I can't tell it's the same organization. That's a problem. That's it. That's going to be a really tough starting point.
I agree.
All right, let's talk about mission, values, vision, and values. You know, the biggest piece here is, you know, do you know what they are? Are they old, new, long, short? Could they use a refresher? Sometimes this is just a quick run through, but just making sure that it really says what you still are. Next, let's look at the data. You know, data. This is a major area of opportunity as well as potential for failure within an organization as you're doing a strategic plan. You know, you need data to understand so much of this. There's a lot of data, as I said, in the community health needs assessment, if you do it right. There's not much data on it if you just check the box. But you also need to understand, this is stuff that we've done a lot with Mike, is, you know, the service area definition, and then what's happening in population trends. You know, and part of this is as you go through each of these, if you know the population trends, you know historical volumes as well as projected volumes, and you can start to figure out what the competitive presence is and the market share. You're really trying to figure out what's going on today, but you're also trying to figure out what's going to happen tomorrow. And really, you know, this kind of goes back to the Gretzky statement, you know, why he was so good, because he went where the puck is, or where the puck was going, I should say. And that's what you want to do here, is by understanding this, you don't start building something in your strategic plan that it looks like what you think you need today. You're looking for, what do I need by the time I get my strategic plan implemented? Where are things going? Am I going in the right direction? Am I moving in the right piece? And the more we understand about this, the nice part about this data is it also helps in that strategic planning process to eliminate maybe some of the misconceptions. Well, we think they go here. Well, if you have some good market trend data, you might be able to say, well, no, the marketing data basically says they go somewhere else. Or everybody knows about this program, but the community health needs assessment says we don't use them because we didn't even know it exists. And so you start looking at those components of a strategic plan and how you can really build that all in there. You know, looks at patient preferences. There's all kinds of things that you can look at here. So let's go to the next slide and talk about the documents. You're gonna have a little bit of different types of documents depending on, you know, if you go with a shorter version or a longer version. It's gonna be a short version. It's basically gonna be a list of goals and some measures. So an example, we're going to grow our patient base by offering comprehensive, high quality and cost-effective array of goods. Measures, we're going to be looking at patient volumes, service line cost accounting, you know, service continuing gap analysis. That's what we're going to be looking at. Are we filling those gaps? Are we doing all those things? That's the short version. The longer version, and this you can see why here sometimes this is nicer just from the implementation perspective, is we're going to dig deeper into market data, mission, all those pieces, the community input. We're going to have goals, objectives under each of the goals. You know, so you start with those pillars, then you get your goals, then you get your objectives, then you have a measure under each one of those. Initiatives, you know, this gets down to the bare of what are we going to do? And then the last piece, and this is why so many strategic plans fail, is that it's a time frame and an accountable party for each initiative. You know, do you talk about your strategic plan at every board meeting? I have some facilities that do. They may not go through the whole thing, but there's a pillar that gets reported on each time. Where are we at? What's going on? Who was accountable? What was the timeline? Are we meeting that timeline? And there's an awful lot to be said about what gets measured is what gets done. And so we can really see some real activity and some real movement in the organizations as they go down that path. Finally, let's get to the last section on documents. Here's just an example the pillar. So in the next slide, we're going to see the pillar of growth. And so here you can see an example. Goal number 10, description or the outcome, to increase, enhance capabilities, services, and return on investment. So the objective, what is it we're going to do? Community health care needs are met by our organization. Then how are we going to measure it? How are we going to know at the end of the day that we did what we said we're going to do? Gaps in healthcare services are reduced. We have relationships with other providers to assist us in meeting local needs for those things that we don't take care of. And return on investment and financial performance of services are being measured and reflected upon. That's how we're going to measure it. So what's our initiative? How are we going to do this? We're going to have quarterly reports to the board to review new service lines and add reports to manager meetings, medical staff, and quarterly. We're going to have ongoing reporting going back to the organization. And when's our completion date? Who's going to do it? Well, the COO is going to be responsible of this, and they're going to have a process in place by June 20th of 2022. Now we've got steps that we can go back and report on and hold ourselves internally accountable. Accountability gets kind of a bad rap. We like accountability if somebody else is held accountable. The best that we can do in a strategic plan is hold ourselves accountable. It makes us all more successful. And yes, you know what? We're not going to succeed every time. But if we're going to succeed more often, we have to have measurements to know where we're at and how we're getting there. So with that, it's now time to turn it back over to Mike to talk about how do you go about tying the marketing plan around this.
Great. Thank you, Ralph. Excellent segue. And in fact, one of the things I would just mention is that, when Ralph was talking about, strategic planning, and then we talked about the one pillar, if you're using that terminology, the pillar and that pillar of growth, for the most part, and there's exceptions to it, but marketing is really supports that growth goal, or at least it should, that growth pillar, because really marketing should not just be considered advertising. Marketing should be about how are you growing as an organization, how are you growing service lines, how you're identifying service lines. So I'm going to build off of some of the things here that Ralph said, again, very data-based, which is why we work together so well. Again, kind of what Ralph mentioned as far as the strategic planning process, same with marketing. The point is that you need to have a process. It doesn't have to be, it's going to be what works for your organization. I won't go through all this, but I just want to give you a couple highlights of when we're working with organizations, some of the key elements of this, and you can kind of just see here we have it into different stages. But the first part here is, again, where Ralph was talking about here, the market analysis and those types of things, just critical. And so it's so important. We often complement that with, we're going on site and we're interviewing people, members of the community, members of people on site, because we're also looking at, are there inconsistencies even sometimes with people within the organization, or what are some of the things that we need to be aware of that we're not going to see on a piece of paper. So as an example, there are some organizations where there's some public relations issue that has really hit them, or there's some where there's just a really strong, there's a morale problem in the organization. And these are things that need to be identified and addressed, because no amount of advertising is going to fix that. You have to fix your own house first before we start to talk about and convince people to go to your organization. Under that stage 2, and we'll talk a little bit about this, but there's service line prioritization. So kind of similar to the concept of strategic planning, which is not only what are we going to focus on, but what's going to have more of an emphasis than others? What kind of resources or are we going to devote to certain initiatives? We can't be everything to everyone. So how do we make those decisions from a objective base? And then similar, the treatment plan, or what we call the marketing plan, just like what Rolf said when it comes to strategic planning, it's having measurable objectives, time-based, geography-based. We'll talk a couple examples of that in a second. And then the last part is the actual execution of that plan. So where do we start? As Ralph said, data, data, data as much as possible. And you can develop that data through a number of different ways. Certainly some of the focus groups and things like that I talked about, certainly the market analysis. I mean, the more information, the better. You know, I can't tell you how many times we've maybe started a new relationship with a critical access hospital, and they'll say, you know, we just need to make people more aware of our services, and so we need to do an ad campaign. And I'll say, well, you know, I'm kind of talking about, let's back up and kind of, you know, we can do that, but let's make sure we know what we're trying to accomplish here. And, you know, as an example, you know, awareness certainly is really important. There's no question about it. But think about things in your, whether or not it's in healthcare or not, you can be aware of something, and it doesn't mean you're going to go there. I mean, it's the first step, certainly. But, you know, not to get, you know, too academic here, but in general in marketing, you have this cycle where you say awareness, interest, trial, preference. Well, the preference part is we have to give people a reason to go there. And it's not just close to home. You know, we hear that a lot, and there's some advantages to that, but we want people to go to your organization for other reasons besides that it's the closest place. So again, when we look at data, Ralph talked about, you know, the market analysis, very critical. This is where we're forecasting patient utilization, and in the work that we do with Eide, they have a number of different tools that complement some of the things that we have, being able to dive a little bit deeper. But as you know, just as a review, we're accessing everything from, you know, what are the needs in the community overall? What kind of projected demographic changes are we going to see? How is that going to not only impact the effectiveness of our marketing, but how is it going to impact what services we're going to provide? Okay, and then just looking overall at trends and volumes. What are the competitors doing? Are they, you know, are there new services that are coming in? Are there weaknesses that they have that maybe we can take advantage of? So just kind of looking at that big picture. And simple as it sounds, really defining your service area, but specifically within a primary service area and a secondary service area, looking at a number of different examining a number of points among, you know, age, income, population, payer mix, you know, all kinds of things. Just the more information you can have, the better. And not only having that data, again, helps you in terms of your strategic planning, but just being very logical and very strategic in how you're doing your marketing instead of just kind of shooting from the hip. The more information, the better. So the market analysis, again, this is where in many ways where Eide helps us out, but utilizing some information from the advisory board, other data that they have as well. So, you know, generally we might have access, you might have access to certain, you know, public data. Sometimes it might be a little dated, what have you. It's certainly things that we're going to use in conjunction with other things, but really looking overall at where the market's going to go. And again, that competitive presence that we've talked about. So as an example, you know, this is just for reference, but, you know, this is, you know, looking at data and analytics, and you can, you know, this is, you know, these particular areas are shown right here. But you can see here kind of, okay, what's the forecast for these years, and what's the 5-year, what's the 10-year growth? I mean, really, you know, amazing information to be able to really make some decisions. You think about it from, you know, okay, what areas are we going to try to grow, and do we have the opportunity to do that? You know, it even helps in the recruitment process as well, you know. And I mean, example that I'm sure many people can relate to when we're doing, you know, recruitment, even of, let's say, primary care. You know, you know, certain where volumes, you kind of have, you know, you have a pretty good benchmark of, for instance, how many patients per day a provider should be seeing. And, you know, candidly, in my experience, you know, providers generally say that they are at capacity. But when you look at the actual numbers, okay, where are they really compared to what the standard should be? And then you can base it on, okay, then where do we see the growth? Now, having all of that data together, you can make a decision to say, well, really, do we need new providers, or really do we have enough to capture what our potential is at this point? So, you know, so lots of decisions around that. And also, you know, even if you're looking at, okay, let's say a particular area, and we have some examples of that, and I won't show you today, but we have a customer we work with, for instance, in Montana called Barrett Hospital and Clinics, and they went through this process a little bit and talking about, well, we want to expand in pain management and in a couple other areas, but as we look at that projected volume, we can't quite justify bringing on a whole new provider for that. But let's look strategically and say, there's some other opportunities. And so they ended up really cooperating with what would normally be competitors and kind of sharing salaries and things like that. And it's worked out, tremendously for them. So it's just having that data to be able to make those types of decisions. And so you can see here again, that was more on the service line perspective. This is maybe talking more about particular procedures, things like that, because as we are doing our marketing, yes, we're looking at specific service lines, but oftentimes we're trying to market a particular procedure, and how do we get people to come in for that particular procedure. Again, we talked about this a little bit just from a volume perspective, inpatient, outpatient. Again, I mean, if you knew, for instance, you were looking at a 5-year trend at 21% growth, and you want to look at how did that get there. That's going to tell you a lot, right? I mean, it's going to tell you a lot about, okay, maybe not just marketing, but from a facility standpoint, and should we open up a new clinic, and just lots of decisions around there. So that's the market analysis, and then the other part is the market research. Now, Ralph talked, about in terms of a community health needs assessment, that we do a lot of research there, and research, as we'll talk about here, I'm sure you're familiar, comes in a couple different kinds of forms, and some that's a little bit more scientific, and some that's more to guide decisions. Generally, when we're talking about focus groups and things like that, they're not necessarily scientific, but they affirm a particular decision. Whereas a quantitative is more, statistically reliable and those types of things. But either way, the research allows us to gain the right insights that we need. And as I've mentioned, on the awareness and preference type of thing, there's a big difference in terms of understanding that awareness and that preference, and more importantly, is finding that gap in between those two things. So you could have something that has a really high awareness level, but a really low preference level. And then by having that tells you that, maybe in the communication that we're doing, we have to focus more on the messaging. We have to understand more of the why. We have to convince people more instead of kind of telling them the same things that they already know. So again, in that research too, we want to explore what is the in whatever research we do, what is it actually like to be a patient there? What are the, and again, you might get into some of this too, where maybe you're looking at some of your quality scores and your Press Ganey scores and all those types of things, and matching those together. But again, you can look at, obviously we're measuring out migration, and you can be asking people in your research of their top health priorities, or why they prefer to go to your organization over others, or why do they prefer to go to other organizations over you. Just lots of insights. So as I mentioned, I'm sure you're aware, generally speaking, two different types of research, more from a quantitative perspective and a qualitative. Quantitative, it's getting a little bit harder in rural healthcare in terms of, reaching people, but we, for instance, we're not using landlines as an example, and, so many people are getting calls on their cell phones and such. What we're really looking at is we do a variety of methodologies, a lot of online kinds of things, some mailed actually still, and some phone surveys, but and then the analysis comes in where you're combining the results of each of those. But the idea too is that you want to make sure in your methodologies that you are reaching different demographics, because if you're just, for instance, doing mail-in, you're probably not going to reach a younger audience, as an example. So there is some method to the madness, but it's very insightful information. And the qualitative can be very important as well. Like we mentioned, maybe some of the things that you might do as part of your community health needs assessment. But oftentimes I found it really helpful, especially like, I was kind of talking about maybe even that interest and preference thing. So as an example, we've done some things in my career where, okay, the organization is going to focus more on women's health. And you know, there's lots of barriers in terms of, well, in a rural healthcare organization, you know, maybe or maybe not we have an OB service, but even if we don't, can we still in some way position that organization as a destination for different women's health services? Well, we might have all the equipment, people don't know it, all of that, but is there still some perception issues that we need to go through? And so we really sometimes only understand that by really talking to people directly. And even so, if we're doing focus groups, for instance, of women, then we might have different ways that we can do it, where maybe we're going to have an older audience or a younger audience or different areas, what have you, and just learning and soaking in information. And one of the things that I've found helpful in that too is, you know, it all kind of depends on the setup, but if you can have people observe it in real time, or at least take video of that, but to be sharing those focus groups with people within your organization, whether or not it's your C-suite or providers or what have you, so they, you know, even so they can kind of see firsthand. You know, you might do a report for them, but actually they can really see what some of those comments were, and it's really amazing when I do that, how it does kind of change the mindset for people. So advisory groups, depending on your organization, you know, there are things like you know, community advisory groups and those types of things that you know, that we highly recommend. Good way to get insights from people as well, and you know, test different messages and different you know, different programs that you have. So I mentioned a little bit before, you know, about this awareness, interest, preference kind of thing. So this is just an example, just to kind of, you know, look at, okay, what can you learn from a quantitative study? And so, you know, this particular graph is showing, you know, within a secondary service area, and it's showing, you know, okay, what are the results? What's the difference from year to year? And then you can kind of study, well, why did that, was that marketing related? Did that have to do with insurance issues? You know, what was the information that moved that needle in either direction? And you can see here in particular, this one is focused on, again, what we often recommend if you do this is you are, you know, dividing this data into different areas. So in other words, let's look really close at the primary service area and the secondary service area, because these numbers can be completely different. And so we've found that, for instance, when, for instance, there might be a strategy of a secondary service area where the numbers are way lower in certain areas, which you might expect them to be, but then from a marketing perspective, we look at it and say, you know, we're doing pretty well in the PSA. Not that we're going to necessarily ignore that audience, but we're going to place a lot more emphasis in the secondary service area in terms of maybe that area where maybe it's an equidistant opportunity for someone to either go to your facility or to a larger facility. We're going to kind of look at that geographic sweet spot, and not to get into too much into tactics and things like that, but in particular, there's so many ways to target specifically different areas. You know, there's certainly traditional ways like direct mail and things like that, but when you look at digital marketing, we can really pinpoint specific geographic areas. So kind of gives you an example of that. So, and then as I kind of mentioned, you know, we kind of get into the preference part of this. So you can see here, when you start to have this kind of information, you can take some pretty deep dives, depending on what kind of end value you have, you know, overall, how many people have responded to certain things to make sure it's still statistically valid. But things here about, you know, why would they go to one hospital over the other? Would they prefer it over the other? You know, those types of things. And you really, you know, learn some insightful things. So from there, you have that information, and then, okay, what do you do with it? Okay, so when I kind of talked about the messaging before, I just want to kind of just share some broader concepts for you here. And this is that in general, when we look at healthcare marketing, we look at, you know, building that patient experience and things like that, just like we think about from a patient perspective, from a clinical perspective, the word is empathy for me. You know, that our messages and those types of things need to be empathetic. They need to understand the motivations behind your patients or your prospective patients. And again, a lot of that data might help you do that. But it's not always, in terms of understanding that, it's not always in understanding how you're going to market, but it's in what services you're going to provide. So as an example, a customer that we work with in Idaho, they're building, you know, a new clinic. Well, part of what, and we helped them with this, but is to actually do some upfront information first in terms of, okay, at least asking people what kind of services they wanted, what kind of conveniences they wanted, what kind of hours they wanted. Generally, the target for this particular strategy was reaching a younger demographic. They placed the clinic in a really high visible area in which it was the access to a larger facility. So really asking them and accommodating as much as possible what kind of information, whether or not it's extended hours or, you know, whatever it might be, and just really matching your offerings with those preferences. And then again, this is, you know, a little bit more conceptual, and can always give you more examples of this, but just to kind of plant the seed for you a little bit, is that, you know, it wouldn't be a surprise to you that there are a lot of generational differences in terms of how, not only how people want to receive information in terms of what strategies, you know, but what motivates them, you know, what motivates them to change. And that gets back into that preference thing a little bit. So it's a whole different webinar that we've done, but in general, you look and say, well, you know, this, you know, millennials, you know, want more of this. They want to be more part of the process, and, you know, have some buy into things. Or, you know, traditionalists, or, you know, older generation, they trust their physicians more than others do. And just lots of little insights that, you know, that can change our methods. So with that, kind of to switch a little bit here before we open it up for questions and things like that, is that marketing plan. You know, we need to determine the importance of service lines and how do we organize what we're going to do. Rolf talked eloquently about the buy-in to support the organization's efforts, and that is just so critical, because it's something, whether or not it's your strategic plan or your marketing plan, it's something that you have to agree on as an organization. And not that you can't change things based on new things that come in, but you have to stay focused, you know. So I can't tell you how many times when there are organizations that don't have a marketing plan, and a physician, I'm going to pick on physicians, but it could be anybody, but, you know, will say, we need to do some billboards on Highway 52. We need to get that out right now. And unless we have some kind of a focus, okay, you know, here are the priorities, and we communicated them to people and all of that, it's kind of hard to say no. And if you have a plan, you can say, well, here's what our priorities are. We do have outdoor that's planned, but it's for this area, et cetera, and it's something that, you know, you can all support. So real quickly, you know, in terms of goals and objectives, I don't want to be, you know, too basic here, but just to, whether or not it's your strat plan or it's your marketing plan, goals need to be specific and measurable and time bound. So as an example, you know, when I look at, you know, from a marketing perspective, if we have the data, we can get really defined. So as an example, we can say, we want to move the awareness of orthopedic services within this demographic, within this period of time, from, you know, 48% to 54%, you know. Or we can get more business types of goals, like we want to increase our market share from this percent to this percent by this period of time, really placing those goals. And then when we have those goals, just like, you know, Rolf had said before, just wrote this down, what gets measured gets done. That's so perfect, because otherwise, how do we know, right? How do we know? So just a few basic things here, just fundamental types of things to keep in mind. So, you know, I kind of mentioned service line prioritization. How do we know what we're going to do, when we're going to do it? These are generally, and you could come up with your own list of things, but these are things that we recommend that you're looking at in terms of determining, where are we going to invest our marketing dollars? And so you can think of some of these things, obviously, is it profitable, but you may focus on something because it has downstream revenue and isn't immediately profitable, or whatever the patient experience differentiation, all those sort of things. Now, you might look at these and say, yep, they're all important. Now, but at least in your head, or maybe more in your head, I do recommend that, at least as a fundamental perspective, you look as an organization, you build a consensus on what are your top three, and to base your decisions. Because as an example, like I mentioned in that one point about, well, maybe you have a public relations problem that you need to come through. Well, image and goodwill is probably going to be even more important than some of these other areas, for example. And it just helps you make decisions along the way in terms of, something as basic as, well, how much money are we going to put toward the, sponsorship of the Christmas floats, the Christmas parade, versus do we invest a couple more thousand into trying to generate more patients for general surgery? I mean, it's not always that basic, but it helps to kind of make those decisions from a logical and even scientific perspective. So again, your approach can be what you want it to be. This is just kind of an example in terms of a way to look at things, and it's worked. But as you look at those different service lines, to kind of remember that, particularly in rural health, we have limited resources, right? We can't do everything. We have to, and my philosophy personally is do a finite amount of things and do it really well. So the idea behind here is you have various service lines, and you say, well, we're going to break these into tiers. And if it's in tier 1, that means that 60% of all of our resources, whether that's time or it's money, whatever, are going to be devoted to those things. Now, having said that, let's say you have 20 service lines, you might only have 3 things or 4 things that are in tier 1, and then consequently see where the rest goes. And just going through that exercise, it's really interesting to watch some C-suite leaders kind of struggle with that. But it's interesting because it really forces some decisions, because just by human nature, we're people pleasers and we want to do everything and we want to make everybody happy, but we have to make some hard decisions sometimes. So this is an example of, again, you kind of go back to those criteria that I talked about in terms of, how do you make those decisions? And it's going to be different, depending on your organization. And if you really get crazy, we have some clients that want to take it even a little bit further, where on this upper time, you see these different criteria, and they actually decide on a weighting for each of those, which I love. Sometimes it's a little bit more academic than people want to get, but if you wait, because you might look and say, yeah, profitability is important, but or actually, where we are in terms of our patient experience percentile is important, but honestly, I want to weigh this more toward profitability in terms of our decision making. So if anything, going through that exercise, really encourages some participation and some engagement. So again, wanting to leave some time for questions here. I'll just kind of summarize the presentation that Rolf and I presented up to this point. So again, data-driven decisions allow you to form a solid strategic plan. It allows you to make certain decisions that you need to make, allows you to focus, allows you to see if you're going to keep aligned with your mission and your vision and those types of things. And then ultimately, that those things will lead to helping you develop a marketing plan as well. Market analysis is critically important. I mean, how do you know where you're going to go if you don't know where you are right now and you don't know what the opportunities are? Market research, again, we've talked about. And again, aligning your marketing plan with that as well. So Rolf, I didn't mean to steal your thunder here. Was there anything else on the summary that you wanted to discuss before we go to questions?
No, I think we should get to questions. We got a couple minutes left here, and give individuals a couple minutes
Sounds
to
good.
ask specific questions.
Sounds good. Sounds good. All right, Colleen.
All right, first question I have is strategic planning more important as it has been in the past? So is it more important today than previously?
Yeah, that's a great question. I think strategic planning has always been important. The thing that COVID should have taught us is that the industry has turned upside down. And so with all of the technology disruption, the changes in how things are being done as far as telehealth and patient preferences and things like that, again, that strategic plan that you may have done in March of 2020 just really may not be relevant anymore. It's not that you did a bad plan at the time. It was what was right then. But we need to start looking at, as we try to get out of this COVID PHE, what is the future going to look like? And we don't know what the quote new normal, or whatever what people want to call that, whatever the future is going to be. We don't know exactly what that's going to look like, We just know it's not going to look like the past.
Excellent.
Thank you. Another question, this is a good one. What data sources can rural hospitals use with a limited budget to allocate to data?
I can throw a few, and then Mike's probably got a few there too. You know, the one thing that we would say is that, you know, start looking at what's available in your state. And each state's going to be different. Some states are very robust. Some definitely have a much bigger challenge than others, and they're very limited as to what's there. If you don't have that, sometimes we've actually done some things with commercial payers, where maybe your major commercial payer can give you an idea of where your population is going. It may be payer specific, but at least it gives you some thoughts and some ideas. If you are part of an ACO, I like to look at what's going on in the ACO data, where you have access to when they don't come to you, where are they going? And then you start digging into the whys. None of these things are probably perfect by themselves, but it's taking it in the aggregate. And then there's obviously commercial data and things that, you know, us or others have access to.
Yeah, the only thing I would add to that is it is so dependent on which state you're in as well. So who's ever asking that question, if you want to email us separately, we might be able to give you some individual suggestions, you know, for your state. So
I have another one that came by. What are a few tactics to get frontline staff bought into a strategic plan? It's not pay or staffing. Will it be important to them?
So, sorry, can you repeat the question one more time? Just how do you get,
Yeah.
okay, say it one more time for me.
Yeah, how do you get the frontline staff bought into the value of the strategic plan? If it's not pay or staffing, will it be important to them?
You want to start, Ralph?
Sure. So I do a lot of operational work with staff, and I think a lot of it comes into the communication. So the earlier that you can involve them, and so we talked about the two plans, you know, where you got a much larger group. The larger the group we have that at least get to provide input in things, the more that they have a potential to feel heard and listened to and engaged. And sometimes those department heads and things will actually go back to the rest of their teams and say, hey, we're working on some strategic planning. What kinds of things should we be thinking about, talking about, stuff like that. So it's that initial request for input, listening to all of it. You don't have to make a decision. I thought Mike made a great point there that it's not consensus, but people need to feel like they're given an opportunity to provide input. And then it's the communication back. Oftentimes things don't happen because the people, the frontline people, can't even tell you what the strategic plan is because it never leaves the desk or the shelf that it's put on after the plan is done. You got to keep it out there and consistent.
I can think of a quick example of organization that we work with that had that very interest in how do we engage everyone. And what they did is part of their strategic planning process is they first, before they kind of took things to the board and what have you, they identified various departments and had kind of these pre-meetings before the strategic plan. And so they'd bring in, you know, the department manager, and then department manager might bring in one or two, you know, kind of his or her sort of key champions or what have you. And it was a big, large group, and actually a colleague and I facilitated, where we laid out very clearly out that this is the first step in the strategic planning process. It's ultimately the board's you know, role with administration to develop the strategic plan, but it's really important to get your input up front. And then we're going to be providing the data and the findings from this so that they can use this as information. So what we did then it was like a different facilitations and discussions, and we took notes and everything, but we asked some, you know, key questions in terms of what's the potential to grow in that particular area, where do we see the barriers, where do we see the strengths, where do we see the ideas. And a lot of great things came from there. Now, a lot of things came from there that we were never going to implement, but it was still, you know, some great ideas. And the key to that, though, is, you know, one is you've got to come back and demonstrate to those people that you listen to them, and that what ideas did you take into place, and how was that incorporated into the plan. And we found that ended up being extremely successful in terms of kind of building that buy-in, that it wasn't just something that the people, you know, higher up in the in the pay scale or the ladder did, but hey, we were really part of that.
Thank you. I just have
You're
one
welcome.
more question here. Let's see. What are some common mistakes you see in how rural health organizations plan their marketing activities?
Plan their activities. I guess I would say, if I can just answer it maybe more conceptual right now, which is to say, well, one, they don't do planning. So that's kind of part of it. Sometimes they don't. But I would say just kind of more broadly that to not assume that because you're a rural health care organization that you can't be innovative and, you know, and forward thinking as an organization. You know, I can't tell you how many times I'll kind of hear that sort of self-fulfilling prophecy of, well, this is what we do. And then we'll start to talk a little bit more about, okay, well, the data shows this. And what about, what about this service line? Well, we tried that 10 years ago. Okay, a lot has changed in 10 years. Let's reconsider that. So, I know that's kind of a little more broad, but that I think sometimes is the first hurdle that we need to cross. And Ralph, I don't want to leave you an opportunity as well to add anything you'd like here too.
I appreciate that. Mike, it's one of those things that you and I have talked about a lot, and it's the thing I've raised a lot, is the biggest mistake I find in a marketing plan is the development and implementation of a marketing plan that does not tie in the strategic plan and the community health needs assessment. Mike has heard me probably way more times than he cares to hear talk about an organization that I've picked up to do work with, and I ask them for a copy of their strategic plan, a copy of their community health needs assessment, and a copy of their marketing plan, and I sit down and read them independently, and I think that I just read about 3 different organizations.
Sure.
That to me is the biggest mistake that I see. Obviously, all the things that Mike talked about and that he's seeing on that side absolutely fit in with that. But the biggest part is you got the strategic plan going in one direction, you got a health needs assessment saying you need to go in another direction, but marketing has been hijacked by somebody that's going in a different direction. And at the end of the day, everyone's just pulling people in a different direction, and there's no movement going on in the organization.
Amen.
All right. Well, I don't have any other questions that's come through. So thanks again, Ralph. Thank you, Mike, for putting together this presentation. I love the collaboration. Thank you to all of our attendees for joining us today. As a reminder, you're going to get a link to the recording this afternoon. Before I close out this webinar, do you have any closing remarks you'd like to leave us with, Mike or Ralph?
I'll just say again, thanks for taking the time to join. We hope it was helpful in some ways, or at least affirm some of the things that maybe and maybe just kind of give you that little kickstart to focus more on the planning of your organization.
And I don't have anything to add above and beyond what Mike said. So thanks for the opportunity.
Great. All right. Take care, everyone. Thank you.
Bye-bye.
Bye.